Hi, this is our brain project for Human Anatomy and Physiology 1. My name is Jamie Potts.
My name is Omar Homery.
I'm Molly Rapine.
I'm Sahil Sandhu.
This is the outline of the unfortunate clinical cases we studied. A Frenchman in the 1800s shot himself in the skull. The bullet missed his brain and made a concave dent in the frontal skull. The brain could be seen with no physical damage. The doctor would use a spatula to press on the brain and found that when he did, near the frontal lobe, the man could not speak. There was another Broca's area patient. His name was Leborn. He had epileptic damage to the brain, eroding his ability to speak. By age 21, he could only say one word, which then he nicknamed himself Tan.
The researcher and doctor in this clinical case is Simon Aborton and Paul Broca.
The patients were a Frenchman and Leborn, or Tan.
The Frenchman shot himself in the skull, sharing his frontal skull bone. The brain was visible, so a doctor pushed around the brain with a spatula, looking for symptoms. Leborn, or Tan, suffered from epilepsy and his Broca's center was significantly damaged.
Symptoms included speech issues when the frontal lobe was pushed on. The patient would go mute. Leborn could not speak by age 21, but thought he could understand speech.
The experimental vehicle in this clinical case was a person.
The research question being asked is, what part of the brain makes it so that the patient can understand language but not speak it?
The experimental design was with the Frenchman. They were able to see the effects of his speech while they pressed on his brain. For Leborn, they were able to observe his behavior over the course of a few weeks. That by the time he died, they could observe his brain and piece together the cause for him not being able to speak.
Here are two pictures that show what the normal biology of the brain looks like. Specifically, the Broca's area is intact. The picture on the right highlights the area in blue. This is the part of the brain that was affected after the Frenchman shot himself in the head, and the part of the brain that was eroded in the Leborn due to the epileptic seizures. The Broca's region in the dormant cerebral hemisphere is known to mediate the production of language, but also contributes to comprehension.
In the picture on the left, we can see real images of the Frenchman and Leborn's brain from many years ago, specifically their Broca's area and the damages to them. Due to the study of these two cases, Broca's area is now associated with Broca's aphasia, which is loss of articulating speech. Broca's aphasia typically refers to the injury of the Broca's area and inability to speak due to a stroke, though it can be due to any injury or damage to the Broca's area that can cause inability to speak. Both Leborn and the Frenchman had Broca's aphasia, which further helped neuroscience and their ability to understand more about the certain areas of the brain.
Bottom line conclusion of what was learned in this case or experiment and how this discovery advanced the field of neuroscience. In conclusion, Broca's study was essential in determining that localization of the brain is real. Different parts of the brain are responsible for different things. Broca was able to identify the part of the brain that was responsible for speech with the help of his patients. This part of the brain is now named Broca's area after him for discovering it. It was found that Broca's area was responsible for speech. It is the language node that was discovered and located near the back portion of the frontal lobe.
Broca's area is responsible for syntactic analysis, mathematical calculation, music processing, and language comprehension. Recently, a more complex picture of the role played by Broca's area in language domain has been given. Several studies demonstrated that Broca's aphasics, in addition to their deficits in production, are also impaired in speech comprehension. Broca's aphasics also have been found to have difficulty comprehending syntactically demanding utterances such as semantically reversible sentences that contain non-canonical word order.
Thank you for watching.